Dr. Nimanya Stella. I am a pediatric surgeon and currently the head of a 5B Pediatric Surgery Unit at Mulago National Referral. So the Pediatric Surgery Unit looks after babies with children between 0 days and 18 years with conditions that need surgery. That's basically what the unit does. So we manage children who need surgery between that age group. Usually for the newborns that the unit receives, these are usually emergency cases. These are children who, if they don't get their surgery within about 24-48 hours, this is going to either affect their outcomes or actually affect their life. So how the unit supports them is it gets them worked up, or can I say investigated, to understand what exactly is going on. For those who maybe might not have had a diagnosis made before they are born, so we are able to investigate them, stabilize them, prepare them for surgery, get them to surgery, and then support them in their post-operative course until they are discharged home. The unit also does work on elective children. These are surgical conditions that can actually wait. So those who surgery can be done at a later time without affecting the child. Again, these ones are supported in the unit. We usually book them. Surgeries are free of charge on a first-come, first-served basis. So those we actually do also along as time basically goes by when theatre space allows. For the unique surgeries, I would honestly say, I would think of the complicated ones, the ones that usually require a multidisciplinary team. So this is the pediatric surgeons with other members like pediatric orthopedic, pediatric cardiac. And usually for this, it's, I would say the most complex or most unique would be the conjoined twins. This is usually two babies that are joined together and you're trying to separate them. Not only just separating them, but making sure they actually have a good quality of life even after they've been separated, to go and live just like any other normal child would following separation. Okay, so the case of conjoined twins we actually have is a set of girls. Actually, conjoined twins is more common in girls than it is in boys, so they are joined both at the chest and the abdomen. We are waiting to do investigations, but just from physical examination, it seems they have two hearts. The livers might be joined, the bowel might be joined, but investigation is going to tell us what they might be sharing or not sharing. So our hope is that we will work as a multidisciplinary team, and I think that's the beauty of Mulago Specialized. They have specialized pediatric teams, so pediatric cardiologists, pediatric anesthesiologists, pediatric nephrologists. So there's a team of specialists that are just dedicated to pediatrics, which basically gives these children a very good chance at actually survival once their surgery is done. Ideally, conjoined twins should be a condition that's diagnosed antenatally. I think strengthening antenatal systems would actually be good, because most of the children we actually get, it's diagnosed at birth. So most of them are coming in as referrals. Now we do work with Kawempe and Mulago Women's Hospital. These are neonatal intensive care units that are equipped with neonatologists and pediatricians. But sadly, they don't have pediatric surgeons. So we work closely with them because, like I said, it's a lot of teamwork that we do. So as much as these children are referred to those units, they will still end up here with us, because this is where the surgical team is, with a multidisciplinary unit that is. So I would say since 2012, we've probably worked on a set of, I would say now 12 to 15. We've worked on a good number of sets of our conjoined twins here. So if two babies are sharing one heart, we've had sets of those. You can't split one heart to support two babies. Or if one baby has died while the other is still alive, what we call emergency separation, where we are going in quick. Again, the outcomes are bad. Outcomes are good for the babies who are stable. We're able to grow them a little bit. I think we've had 3 sets. There was Doris and Stella. There's Brenda and Gloria. Those ones recently celebrated their, I think, 2nd birthday, 3rd birthday. And the 3rd one was Kampulira. So I would say live, we have 3 sets that are still alive, though we've also had those who've separated and have died to malaria. Like the conditions, they go back to acute watery diarrhea. Like we do separate them, they go back to these places where they are still being children in these places that they actually are. Daily we get about maybe 5 to 6 admissions coming in. That's both the newborns and the older children coming in, especially as emergencies. So our admissions are emergencies. When we bring in electives, those are planned for. So we have a booking system where we have children we have planned for to do. I would say 5 to 6 admissions a day. Discharges might be 2 to 3 on a good day. So that is basically how I would say the turnover rate is.